Good evening, everyone. Welcome to our ICU lectures. Today we are going to have a CME concerning how to prevent infection, especially in our ventilated patient. So for us here in ICU, we usually have patient on mechanical ventilation, and we have a pneumonia called, the pneumonia is called? VAP, yes. So in full, we have ventilator-associated pneumonia in ICU. So for our patient here in ICU, mostly some can get VAP due to predisposition of patient. Let's say like the patient was being intubated and he experienced vomiting during intubation and he get aspiration pneumonia. And also it can be from healthcare provider. In this way, for healthcare provider not using aseptic technique during sanctioning. So we should sanction using a sterile procedure. You use sterile grab and sterile descent and also sterile sanction catheter. And also we have other measures that we can do to prevent VAP. Number one, we can start from Naomi. Naomi, which measure can we take for preventing VAP?
Using sterile procedures.
Exactly, using aseptic technique. So during aseptic technique, we will have a sterile dressing set. We will use a sterile sanction catheter and also sterile surgical gloves. Thank you, Naomi. And then for number two, what else can we do, Sam? What else can we do in ICU to prevent VAP?
Oh, suctioning.
Sanctioning. Aseptic sanctioning. Yes, we have covered it here. Also, the other thing we can do is oral care. Oral care, what solution do we
Chlorhexidine.
use? Chlorhexidine mouthwash, 2%. So, the good thing with chlorhexidine, it is antibacterial and also it serves as a mouth freshener and it prevents infection. The other thing we can do during nursing of our patient, we can do head of bed elevation. At what degrees, Sam?
30 to 45.
30 to 45. 30 to 45. So this usually prevents that even if the patient vomits, the patient cannot aspirate the vomiter. So it will prevent the VAP. Also, for our patient, we can try to check every day if they meet criteria of extubation, and we extubate them so that they don't stay in ventilator, because this is an invasive procedure and it brings infection. So we try every day to do assessment for ventilator weaning off of the patient, and you can check if they are meeting the goal. And also the other point, Paul, do you have a point? Paul has no idea. So another thing we can do also for our patient is hand
wash.
Hand wash, yes. What solution do we use for hand wash, Paul? We can sanitize.
Water and soap.
Water and soap. Yes, especially for water and soap is the most effective way. For sanitization, maybe you do like 3 times, 4 times, and then you do water and soap. Water and soap is the most effective so as we prevent infection. Before, after, and during procedure, we maintain sterility of our patient, right? And then for other hygiene, it's before touching patient, after touching patient, yes. So for our team in ICU, I will end my CME here. We continue doing the prevention precaution for VAP in ICU, and also we nurse patient according to the protocol of ventilator. We make sure the head of bed is elevated, we do oral care and aseptic technique during sanctioning. Any question? No question. Thank you. We will end up there. People can write their name in the CME.